Thank you for joining the Brain Injury Alliance of Iowa to talk about brain injury screening. So why do we encourage brain injury screening? Brain injury screening is not something that is systematic across areas of human services. However, identification of history of brain injury may be critical in increasing individual outcomes for those who are affected by the long-term effects of brain injury. For a quick review, let's note that screening is not an assessment for diagnosis. Assessments have a different purpose, such as determining clinical eligibility, meeting diagnostic criteria, identifying functional needs or challenges, and they can even be used in developing service plans. Screening tools can be used to investigate if someone may need to be assessed further. So as a reminder, screening tools are not to be used to diagnose someone. Information can be used to guide next steps based on the outcome of the screening. The HELPS Traumatic Brain Injury Screening Tool is one example of a screening tool that was developed in the 1990s out of a grant project. It has been updated to reflect recommendations made by the CDC. It can be found online, as well as from the Brain Injury Alliance of Iowa. We certainly recognize that not everyone experiences a brain injury has long-term impairments. This screening tool addresses 3 areas. 1, if there was an incident. 2, the severity of the injury. And 3, if symptoms persist for the person following the injury. This screening tool uses the word HELPS as an acronym to ask questions of the client. You will find that using motivational interviewing skills may be useful during the screening process. Let's go through each one. H. Have you ever been hit on the head or hit your head? Here you may be given the opportunity to encourage an individual to think about injuries from when they were a child to current events, including a variety of examples such as falls, motor vehicle crashes, sports accidents, or assaults. E. Were you seen in the emergency room after the injury? Here you might ask about any type of medical intervention, or depending on the type of population of individuals you are screening, you may ask if they should have been seen and were unable to access medical interventions. L. Loss of consciousness or altered consciousness. Some people will associate buzzwords such as having your bell rung, being dazed and confused, disoriented. P. The screening tool provides a list of problems to ask about if the person experiences in their life. You may determine if you want to have the individual describe their experiences or concerns. S. Significant illnesses or sicknesses. This screening primarily asks questions about traumatic brain injury. So this question allows you to ask about other areas of acquired brain injury. The tool has a section on it that allows you to score and provide either a positive or negative score for possible brain injury. Again, the screening tool is not a diagnostic tool, but can provide guidance on next steps if needed. With a positive score, you may want to be prepared to discuss with the client what this means and how to proceed with accessing further assessments through appropriate referrals. You may want to be prepared to provide them with a copy of their screening to assist them in communicating with appropriate clinical providers. As we remember that this is not a diagnostic tool, the individual may be able to use the screening tool to discuss the information with an appropriate provider. As an additional resource, the Brain Injury Alliance of Iowa is available to provide support in locating providers through our Neuro-Resource Facilitation Program. We provide this service to individuals who experience brain injury, caregivers, and we also provide technical assistance to professionals in the field. Thank you for joining us today. Please feel free to reach out with any questions. You can contact us at our toll-free number, 855 888-444-6443, email us at info@biaia.org, or visit our website at biaia.org. Thank you and have a great day.